In this edition of Generations, we get the latest reaction from AARP Connecticut about how people in the state living in nursing homes during COVID-19 are doing and what more needs to be done to keep them safe and well. And Judy Jencks from seniorcenterct.org joins us to talk about her thoughts on the nursing home situation too. Hello, I'm Brian Scott Smith and welcome to Generations, a podcast for people of your generation. If you live in a nursing home or long-term care facility in the state or have friends, family or relatives who do, you'll be all too aware of the restrictions that have been placed on these facilities, those who live there and those who wish to visit because of COVID-19. It's become a hot-button issue, as our seniors have been the hardest hit when it comes to COVID deaths, and a report compiled by Mathematica for the state recently said Connecticut could have been better prepared for the situation. One national organisation that advocates on behalf of seniors is AARP, and joining me today on the podcast is Anna Doragazi, Advocacy Director for AARP Connecticut, to talk about the ongoing situation facing our seniors in care facilities. Anna, thanks for joining us.
Thank you so much for having me today.
Now, AARP Connecticut, of course, a very well-respected, well-known advocacy organisation for the older community. We're talking today specifically about COVID-19 and the situation with regards to nursing homes. What's AARP Connecticut's position on this? How do you feel about what's happened in the state?
Sure. So I don't think we're alone in looking at the COVID-19 infection and death numbers in Connecticut and feeling just overwhelmed and appalled and believing that we should have done a lot better for our older residents, for people with disabilities who call nursing homes and assisted living facilities their home. I think because Connecticut was one of the states that was hit early on during the pandemic, we didn't have an understanding of how the virus was transmitted. We didn't know in that sort of first critical month that we needed to be covering our faces, that we needed, all of that PPE, that we needed the hand washing. And that was where we saw just tremendous loss in nursing facilities. I think since March and April, we have shown great improvement. I think we've applied some good lessons in those facilities, but we're still seeing outbreaks from place to place throughout the state. If you look at the data, there are still nursing homes where you're seeing, half of residents being infected. And, 7 months in the pandemic, that's really unacceptable, and we need to be doing better.
The state, interestingly, ordered up a very expensive report from a New Jersey-based organization called Mathematica that does these types of reviews. And the state asked them to look at, nursing homes, long-term care facilities. Those reports are now in. We've all had an opportunity to look and digest the content. There is a lot of content to go through. But some of the sort of findings that really stood out that Mathematica came up with was that the state really was found lacking when the outbreak happened, and obviously nursing homes in particular. Were you surprised to read some of those findings?
I wasn't too surprised by any of the findings, in part because some of the things that came up in the Mathematica report were things that advocates have been looking at and asking for years. In particular, I think Mathematica really honed in on the idea that staffing levels plays a very important role in the care that people receive and also in a nursing home's ability to stem COVID infections and deaths. So that was one of the pieces that, in their final assessment, Mathematica said, there are a lot of factors that went into how well or not well a facility did, including things like community spreads, or if you were in a community that had, a lot of COVID infections, it was more likely that those infections would find their way into a nursing home. But also in terms of, what was under facilities control, facilities that had better staffing had better outcomes. And again, this is an issue that advocates have been looking at for years because, COVID-19 is a particularly infectious, particularly deadly disease. But, every year we have a flu season. Every year we have nursing home residents who, are not receiving the time and care that they necessarily need in their facility. So no, issues like that were not surprising. Something that was a little bit surprising to me was how much long-term care was not at the table in terms of emergency preparedness and planning. Mathematica really honed in on that as well and talked about how, hospitals were really a main focus and very much at the table from the early days of the pandemic. And we didn't do as good of a job at including nursing facilities and home and community-based services. So I think there's a real opportunity there moving forward to make sure that, anyone who is providing really critical services is at the table, not just from day one of an emergency, but from, the months and years leading up to day one of an emergency.
Yeah, I think what was interesting about that comment you've just made about the emergency preparedness is that the plan was actually sort of years out of date and that they'd not actually done anything to bring it up to date, that was interesting. Another thing that I found interesting as well in their interim report is that they said that infection control staff at the beginning of the year was sort of like sorely lacking. The state did quickly sort of like get that amended, and I think it took them, 3 or 4 months obviously to get those figures back up. But that in itself seems rather worrying, COVID aside, that infections are going to happen in closed-in spaces, and yet there didn't seem to be the amount of staff at the Department of Public Health to cover that.
Yeah, and as I mentioned, COVID-19 is a particularly infectious and deadly disease, but it's not the only one. There's a flu season every year. So, I think that infection control piece is something that is going to need a lot more conversation and a lot more attention moving forward. And I think there's also a conversation to be had around, what are other options for people to receive care? If we look at a nursing home model, or if we look at other congregate care settings, and we can't think through ways to control infections, if we can't think through ways to adequately staff these facilities, then maybe we need to use our imaginations to imagine different models, or to look more toward home and community-based services as the model where we should be investing more time and attention moving forward.
Before we move on to that, because those are very important topics, and I do want to touch on those with you, I just wanted to raise one more question with regards to the state. And I don't want to put you on the spot, as it were, but I would just be interested in your thoughts on this as an organisation. Of course, we only have an acting commissioner for the Department of Public Health. We did have a commissioner, and Governor Lamont removed her. We don't know why, ultimately, and we may never know why. And of course, the acting commissioner is actually the commissioner of the Department of Social Services. Do you think that, this sort of breakdown that sort of happened, and then this sort of knee-jerk reaction to get somebody put in place at DPH possibly didn't help the situation either?
I don't have any specific comment on those pieces. I don't have any special insights into, what transpired at DPH or within the administration. So, I'd hate to speculate, on that point, since I don't have a lot of good information.
That's a fair comment. Let's turn to visitation, because obviously that's only recently sort of just had some slight amendments to it, so that, relatives and friends can actually now finally have some better, still not great, but better visitation rights. What are your thoughts on what the state's come up with at the moment?
So there really has been a roller coaster when it's come to visitation in nursing homes. One of the very first orders that we saw coming out of the Department of Public Health on March 13th completely eliminated visitation in nursing homes, except for, some very sort of rare circumstances. And that restriction included, privately hired aides who sort of supplemented care for folks in facilities, so that the long-term care ombudsman and her team were not able to go into facilities. So that had a big impact, because, visitation is important to address people's mental and emotional health. But there was also a real practical impact that visitation ban had as well, that people who were in charge of, looking out for abuse and neglect were no longer allowed into the facilities. Folks who were providing, whether it was privately hired aides or whether it was family members, they weren't able to go into the facilities to provide really important care that people needed from them. So I think that, that aspect of the visitation ban was really damaging for mental, emotional, physical health. But, also at that stage of the pandemic, I do want to give some credit to DPH and to the administration who were facing a really unprecedented situation. I don't think anybody on March 13th could have said, here's the perfect plan moving forward. I think that decision did ultimately save lives. But, 7 months into it, we still have a situation where we're not back to regular visitation. We don't have, those additional aides or family members back in the facilities providing care. So the situation that we have now, I noticed, I mentioned we've kind of been up and down with visitation. We had that complete visitation ban in March. In August, there was some expansion of visitation so that outdoor visits could happen. DPH started allowing for indoor visits for end of life and compassionate care situations. And then at the end of September, CMS, which is the Federal Centers for Medicare and Medicaid Services, which regulate nursing homes, issued new guidance related to visitation. And DPH is deferring to that CMS guidance at this point. So there's more visitation indoor and outdoor allowed under those CMS guidelines, but still there are restrictions in terms of social distancing, in terms of wearing PPE. So the situation has improved, but still hasn't really addressed, folks who are doing hands-on care in those facilities.
As we said, AARP is an advocacy organisation. What is it that you feel, what else needs to be done to try and address this very important issue of family and loved ones, etc., being able to visit, their loved ones who are in either a nursing home or a long-term care facility?
I think what we need is a long-term care system that is going to be safe for folks and that's going to allow them to not default into total isolation when there's a crisis. So I think we need to do whatever it takes to ensure that nursing homes and assisted living and other long-term care facilities have great infection control so we can trust that even if an infectious disease enters one of these facilities, it's not going to be catastrophic the way that we've seen. I think we need to see more of an emphasis on serving people in home and community settings so that, instead of having 100 people in a facility where a disease can, move through that population of 100, you're serving people in their homes, which, incidentally is where most people, if they had a real choice, would choose to receive services. And I think, that some of the things that came up in the Mathematica report include some workforce issues. So how do we make sure that we are, cultivating a well-paid, well-trained workforce so we don't have workers that need to work 2 and 3 jobs all at different facilities in order to make ends meet. So I think once we address some of these fundamental underlying issues, once we get that in order, then we can start talking about how we fix visitation. Because if those fundamentals aren't lined up, then visitation would continue to pose a risk. So I think, it's hard to look at the visitation piece without also looking at some of these, bigger issues overall.
The nursing home and long-term care, industry is $1 billion industry. And so over 30 years ago, back in 86, a study conducted at the request of Congress and the Institute of Medicine found that residents in nursing homes were being abused, neglected and given inadequate care. And then they came up with the Nursing Home Reform Act. Like I said, that's over 30 years ago. But 30 years on, we're now seeing, and I appreciate, we must keep stressing this, COVID-19 is an unprecedented situation. But that said, we are still seeing inadequate care. We're talking about these issues in our nursing homes and long-term care facilities. Clearly, it seems that the Nursing Home Reform Act is not doing its job. And also, where's the accountability and the oversight?
Right. And I do want to pause to make clear that, I don't mean my comments to be disparaging of individual staff in nursing homes, or even of facility managers. My mother worked in a nursing home for years, and I know that these folks are turning up to work. They're risking their lives in a lot of cases and doing their best to provide good care to folks. But that said, this does bring me back to the question of, is this the best model? Is this how people want to receive care, as they age or due to a disability? Can we create better systems in home and community settings? And, Connecticut, to the state's credit, has really been moving to rebalance services in recent years, to take more people out of those congregate settings and either move them back into home and community-based settings or to keep them there to begin with. But I think we're going to need a lot more care and attention to those services, the nurses' aides and the other providers who can go into those homes, but also looking more holistically at what does it take for people to stay in the community as they age. Do we have adequate transportation? Do we have adequate ways for people to get to doctor's appointments? Do we have ways to keep them socially connected in the community? So it's hard to pinpoint one issue that I think is going to sort of solve all of our problems. But I think what COVID-19 has done is created an opportunity for all of us to talk about, first and foremost, how do people want to receive services as they age? We always have to come back to that and center that. What do people want to see in their own lives and in the lives of their loved ones? And then, have that, if we don't have those bigger conversations about what kind of world could we create, we're just going to keep going back to putting patches on a system that is perhaps not working.
I was going to say, because we keep hearing this new normal, or people saying, well, when we get back to normal, but the reality is, not just for nursing homes, but for so many things that we're seeing, not only in this country, but across the world, but obviously we're particularly looking at industries and whatever here in the United States, is that the normal just wasn't working.
Yeah. And, that phrase, new normal, or, this idea of going back to how things were before, it's such a big missed opportunity for us if we try to just go back, if we keep trying to claw our way back to, how we remember the world being in February of 2020. I'd love for us to all come together and imagine, what could a better world look like in February of 2021 and February of 2022. We have to be long-sighted on this, and we have to expand the conversation. So it's not just, how do we prevent outbreaks of this particular virus in nursing facilities over the next 6 months? That's an important conversation. But that conversation has to happen in the bigger context of, as the population of Connecticut and the United States and the world ages in a way that's unprecedented, what kinds of great opportunities do we have to make sure that we are creating an environment where people have real choice in where they live and how they receive services, and making sure that people are part of that conversation, and that we're thinking holistically, and that we're thinking better.
The point I want to quickly make as well is my understanding is that Medicaid and Medicare make up the bulk of income for sort of nursing homes here in the US. Also, a report that I read recently, or surveys, that 1 in 6 Americans say that they actually want to, live in their homes rather than go to either a long-term care facility or a nursing home. So how do we deal with people wanting to have, home community-based services and take them out of, these traditional areas where we've put them?
Sure. So I think there are a lot of components there. Some of the survey work that AARP has done in the past shows, around, I want to say it's 85% of folks, want to receive care, in their home and community as they age. So, in terms of how we do that, I think we need to make investments in those services. We need to make sure that, you had mentioned Medicaid as the primary payer of long-term services and supports. We need to make sure that, Medicaid is correctly incentivizing where people want to live, or home and community-based services getting the same, getting adequate levels of reimbursement for the services that they're providing. If not, what can we do to change that?
So, just summing this up then, Anna, and thanks ever so much for your time. It's a big, big issue. We're not going to solve this overnight, and anybody who thinks it's going to be solved overnight, clearly, it just isn't. But what do you think are some of the primary things that we need to be looking at as we move forward, COVID-19 or not, when it comes to looking after, our vulnerable and our older members of society?
I think first and foremost, we need to make sure that we are creating safe environments in nursing homes in this particular moment. So continued emphasis on testing, on PPE, on infection control. I think once we've nailed those down, we also have an immediate issue around visitation and making sure that people are able to see their loved ones and interact with them in meaningful ways. We need to focus on accountability. So what happens when nursing facilities are not keeping up with the guidelines around visitation, for example? What options do family members have when they're not able to schedule a visit with a loved one, or they show up for a visit and they're told that it was canceled? What can they do in those circumstances? How can we, really hold facilities accountable to the rules that have been put in place? On that accountability piece, there's also a standing executive order right now that grants nursing homes immunity from civil liability for anything that is COVID related. We need to take a good hard look at that executive order. And, once we've taken that good hard look, I think we need to decide to get rid of it. So, that's immediate. That's where we can start today. As we look forward to the legislative session, I think that's where we can really start digging into some of these issues around how do we, provide better staffing environments for long-term care facilities? How do we look at the staffing ratios? How do we look into supporting that workforce in, a more robust sort of a way? How do we start incentivizing people, and payers to pay for those home and community-based services? How do we make those services available? How do we wrap around services like transportation, meals, home health care, all of those things that make home and community-based services a real option? That felt like a really long list, but, I think there are things that we can keep working on today, and then things, that need to be part of this much bigger conversation when the legislature comes back into session in January.
Anna Doragazi, Advocacy Director for AARP Connecticut. It's been a pleasure talking to you, and thank you for illuminating us on the subject of nursing homes and long-term care. And clearly, as you say, this is a big battle. It's going to be a long battle to get this right so that we genuinely do make sure that we look after our vulnerable and our senior members of society going forward. Thank you for joining us.
Thank you.
So joining us as always is Judy Jencks from seniorcenterct.org. Judy, good to hear from you.
Good to hear from you as well. It's always a pleasure to do these podcasts.
Thank you so much. And likewise, obviously, to have you on this as well. So this particular podcast, we were speaking earlier to Anna Doragazi, who's an advocacy director for AARP Connecticut, about the ongoing situation concerning nursing homes and long-term care facilities here in the state, with clearly COVID-19 still very much about. You're going to carry on that discussion as well. So what are your thoughts on it?
So I just wanted to go over to be sure all of the listeners understand that, it's not the individual nursing home and the workers that we're talking about. We all know that they're doing a fabulous job and doing the best they can in the situation that we're in. So I wanted to make sure everybody's aware that these rules are set by the CDC and the DPH, and then whatever they say goes to the individual corporations that in general run the nursing homes. They interpret what they're given and decide what is going to happen at their facilities. So this has been going on for 8 months, and we don't see any end in sight. If you have a loved one in a nursing home, then you're limited to window visits if the resident has a window that you can approach. Zooms can happen, and those are by appointment. And then there's outdoor visits for as long as the weather holds, but those are by appointment. Some of them are only for 15 minutes. There's no hugging. There's no contact. You have to stay 6 feet away with masks. In general, there is a staff person who is monitoring all of this. So you lose a sense of privacy. And then when they're in the facility, they're totally isolated. They're not supposed to be leaving their rooms. In some facilities, even the door is shut. They're restricted on going out for doctor's appointments. So the resident can say, I really want to see my doctor, but the facility can say, no, that's not necessary because we have medical staff that will, check on you and make sure that you're okay. And if they do go out for a doctor's visit, then when they return, they have to be in isolation for 14 days, which means in general, they don't return to their room. They go somewhere else in the facility for 14 days. And now we have the holidays coming, they're here rapidly. And so will the residents stay isolated? Will they have no contact with family or friends? And we miss the point too of how do the families and the friends handle all of this when they know this is being forced on their loved one or their friend? Somehow, can we refuse to allow this to happen? For Christmas Day, these folks are just going to sit in their room in isolation. How do we handle all of this? And what is the cost of this isolation? There's the overall decline in just their health in general, their mobility. How mobile are these people if they never leave that one room? And what does it do to their mental health? I know the facilities try to do recreation, but is it even meaningful to the resident? Because they're all individuals and, maybe some of them like to do adult coloring, but what about the person that doesn't want to do that, doesn't want to do word searches, doesn't want to do crossword puzzles? What's their recreational activities? How are they passing the time? We know because, we're out here, but because the world is such a different place that we sometimes lose track of, what day it is, what month it is. If you're in one room and it's endless, how do you know what day it is, what the date is, even what the month is? And again, if I was to do the very same thing for the safety and well-being of a 13-year-old, and I said to the 13-year-old, no, you can't leave your room. No, you can't see your friends. No, you can't see your family. No, you can only have visits with somebody if they stay outside and they talk to you through your window. And no, you have to wear a mask. Your visitor has to wear a mask. And you can only have 15 minutes to talk outside. And yes, somebody will be watching and listening all of the time. And remember, you need to stay 6 feet apart. No, we don't care what you want. I'm pretty sure I'd get arrested for treating a 13-year-old this way. But it's okay to treat those in nursing homes the very same way. And this is just so not acceptable. We've got to do something so that they're treated more humane.
Absolutely. And I think, the point that Anna made as well during her conversation is that we do have to look at other ways to provide services for, our seniors, our older generation that is actually in their homes where it is absolutely applicable, because long-term care facilities and nursing homes may not be where those individuals want to be. In fact, we discussed in that part of the podcast that a lot of Americans want to live out the remainder of their lives at home and obviously not in a facility. And that is something I think that does clearly need to, to be addressed. And also, what is of concern, of course, is the fact that COVID-19 still isn't under control. We're starting to see a second wave of it here in the US and, of course, across Europe as well. And getting back to nursing homes, only recently we saw yet another spike in Eastern Connecticut in a nursing home in Colchester. So clearly the situation with regards to controlling infection control in nursing homes still is not what it should be.
The concept of we can control this virus is very misplaced. We have not been able, other than through vaccine, we were never able to control smallpox until there was a vaccine, and all these other natural diseases or whatever you want to call them. We cannot control the spread of it. And I think as a world, we were very naive to think that we could control the spread of COVID. What we did is we slowed and altered it. But we're seeing that supposed control, we're losing control over it.
It is a very difficult situation, and I don't think there is any one correct answer here, but clearly there does have to be some other solutions that can be put on the table to help try and alleviate the situations that many people find themselves in, not only if they are residents in nursing homes or long-term care facilities, or of course the friends and family who have, those loved ones in those facilities, as you say, trying to get access and making sure that their loved ones, continue to have some form of quality of life.
And how are the families and friends going to deal with emotionally, mentally, when the holiday event is taking place and that empty chair is there and they know the person that's supposed to be sitting in that chair is sitting in a room all by themselves all day long? This is multifaceted, and we need to remember we're dealing with people and we're dealing with adults. Some of these adults cannot make decisions for themselves any longer. They have dementia. They could, be a stroke victim. There's reasons why they can't make decisions. But what about all the adults that are able to make a decision? We on the outside, we're told to wear masks. We're told, somewhat what we can do and what we can't do. And then it's left up to the individual to decide what they're comfortable with. We have some people who still aren't going out. We have people who don't go to restaurants. We have people that do go to restaurants. We have people that are out and about. They're making their own decision. And basically, as a society, we respect the fact that, you're making an educated decision for yourself. But we're not doing that with the resident of nursing homes. And I still don't understand why they're not able to make decisions on their level of risk. And then be, the like-minded people be grouped together in the nursing home. So those that want to stay in the room and they're perfectly happy just the way things are, they can do that. Those that want to have some level of, going out or interacting with other people in the facility can. And then those that just say, what the heck, I want to go out and eat, should be able to do that as well.
It is a difficult situation, as you say, and obviously one that's going to continue to be up for debate on many levels, I'm sure, for the foreseeable months, as unfortunately we all continue to try and grapple with the situation that COVID-19 doesn't seem to be going anywhere fast.
No, and is it going fast? It's going to be around we have no idea how long this is going to be around. So how do we continue to alter everybody's life and then dictate to this particular group? Because I really think if anyone does the research right now, prisoners have more freedoms than individuals in nursing homes. And that's appalling.
A very valid point there, Judy. And it's always great to hear from you. And we will catch up with you in the next episode. In the meantime, take care of yourself.
And you too. Stay well.
That's all from this edition of Generations. Don't forget to visit seniorcenterct.org to find out what's going on in your neck of the woods. And if you want to send us a topic to talk about or want to be our guest on the podcast, drop us a line by visiting the seniorcenterct.org website. Go to the bottom of the homepage and click the How to Advertise with Us link to get in touch. From myself, Brian Scott Smith, thanks for listening. Stay safe and we'll catch you next time.